Do you suspect that you may have diabetes? Some early signs to watch out for include dry mouth, itchy skin, and extreme tingling body pain. We'll talk about these and more in this video on 14 early warning signs of diabetes you should look out for. 1. Slow wound healing. Wounds among diabetics may take longer to heal, increasing their risk of developing complications and infections. What happens? Why is wound healing slow? There are several factors that affect your body's ability to heal wounds, and this includes high blood sugar levels. Remember that your blood sugar level is the primary factor that affects how slow or fast your wound would heal. So when you have high blood sugar levels, it can prevent oxygen and nutrients from energizing your cells, as well as prevent the immune system from properly working. High blood sugar levels also increase cellular inflammation, affecting wound healing. Due to consistently high blood sugar levels, you might develop problems with blood circulation, immune system, and nerves. All these affect wound healing. For example, poor blood circulation, which is one of the effects of diabetes, slows down wound healing. This happens because blood can't get easily to the wound site to help with the healing and rebuilding of the cells. A reason for poor blood circulation is blood thickness. With diabetes, blood becomes thicker. Thus, your heart finds it hard to push it throughout your body. 2. Blurry vision. This is another early warning sign of diabetes that can get worse when diabetes is left untreated. The consistent high blood sugar levels can impact the nerves and blood vessels in your eyes. This can cause fluid to seep into your eye lenses. Although blurry vision will resolve, you should still see your doctor, especially if you experience the previous signs that we shared here. If you leave this unattended, it might lead to a more serious condition, such as diabetic retinopathy or even blindness. 3. Frequent infections. While we can get an infection, whether viral, fungal, or bacterial, diabetes type 2 sufferers have them more often than the rest of us. Sugar ends up in the urine when your blood sugar is too high for the kidneys to filter. Due to this, urinary tract infections and yeast infections can develop. Common infections also include skin and gum infections. Bacterial infections common among diabetics also include boils on the skin surface, styes near the eyelids, hair follicle infection, nail infections, and so on. Fungal infections that appear in moist skin folds like around the groin and under the breasts may also occur. Other fungal infections may also appear around the nails. 4. Frequent urination. So, running to the bathroom than usual? This is one of the early warning signs of diabetes that you should know. This condition is also called polyuria, which is characterized by frequent or excessive urination. It is an indicator that your blood sugar levels are high. They're high enough that they spill into urine. Frequent urination happens because the body can't keep up with the glucose amount in the system, allowing some of the glucose to leak into the urine. This can result in polyuria, so you may be urinating often, especially at night. 5. Extreme thirst. This is one of the first signs that you might be suffering from diabetes. Why this happens is because your blood sugar levels become imbalanced due to the condition, which is also called polydipsia. Excessive thirst has been also linked to the other sign of diabetes called polyuria. When you're dehydrated due to frequent urination, this is what happens. You might feel excessively thirsty, leaving you feeling parched most of the time, even without reason. You will feel thirsty because frequent urination leaves you dehydrated. And just like polyuria, extreme thirst happens because of the too much glucose in your blood. Because you have diabetes, you can't use sugars properly. As a result, too much sugar accumulates in your blood. This then forces the kidneys to work too hard in order to eliminate the excessive sugar. Your kidneys should strain to make more urine in order to pass the excessive sugar from the body. This also leads to higher volume of urine and with more frequency. As it uses more water in the body, more water is being pulled from your tissues. As a result, you'll feel thirsty. Thus, you will want to drink more water. This is the action of your brain. It tells you to rehydrate. Thus, you're drinking more water. And due to this, you also urinate very often. Your blood sugar levels will remain imbalanced if you leave this sign and other signs we're sharing here unattended. So, feeling that you cannot ever satisfy your thirst? You might want and need to see your doctor to check for diabetes. 6. Increased hunger. Also called polyphagia, intense or extreme hunger, is another diabetes sign that you should watch out for. Remember, your body makes use of the glucose to feed every cell in it. However, if you have diabetes, this system may be broken when the cells cannot absorb the glucose properly. Thus, your body is always looking for food. This causes persistent hunger. Why can diabetes cause hunger? Insulin may not work properly, or the body is not producing enough or none at all. Without enough insulin, your blood sugar will stay in your bloodstream. This will leave your cells, including your muscle cells, starving for energy. Thus, you will crave for food, and you will continue to feel hungry. What is hunger and hyperglycemia? First, hyperglycemia is a condition characterized by high blood sugar levels. This occurs when your body makes little or no insulin. This can also happen when the insulin your body produces doesn't work properly. As a result, your body cannot take what you eat and convert it to the energy you need. So to meet energy needs, you crave for food constantly. The problem is, you don't feel satisfied with anything you eat. What about hypoglycemia and hunger? Low blood sugar can also cause excessive hunger. This commonly happens among people that take insulin, sulfonylureas, and other diabetes medications. Due to this, diabetics cannot control their blood sugar levels. And whenever you feel hungry due to hypoglycemia, you must eat to raise the body's blood sugar levels. 7. Nerve pain or numbness. People with type 2 diabetes may be experiencing numbness or tingling sensation in their fingers, hands, toes, and feet. Any of these pains can signify that you're a diabetic. This signals nerve damage, also called diabetic neuropathy. This condition doesn't develop fast but gradually. People who have diabetes experience this only after years of having it. Pain can occur in different parts of the body, and they're all related to blood sugar levels, which can be too high for a very long time. There can be 4 types of diabetes neuropathy: focal, proximal, autonomic, and peripheral. Peripheral commonly affect the legs and feet, and sometimes may also affect the abdomen, arms, and back. Autonomic neuropathy, on the other hand, can affect digestion, especially the blood vessels and stomach. Sometimes it may also affect the sex organs, urinary system, and blood vessels. Proximal neuropathy causes muscle weakness and affects the upper portions of the hips, buttocks, and legs. It may also involve pain that starts from the lower back and down to the legs. Focal neuropathy occurs suddenly, affecting head nerves and nerves that go to your eyes. It may also affect your torso and legs. 8. Dark skin patches. Do you notice any discoloration in your skin's folds? It is called acanthosis nigricans, which is another sign to watch out for to detect diabetes early on. Dark skin patches typically occur in the groin, neck, and armpit regions. The skin in these areas will thicken over time. Why does this happen? This occurs due to high insulin levels in the blood. Dark skin patches are common among diabetes type 2 sufferers because its primary precursor is insulin resistance. 9. Itchy skin. This symptom is often a sign of diabetes. For many, it is also one of the earliest signs that they notice. Itchy skin is often associated with other conditions related to diabetes, such as dry skin, fungal infection, and poor blood circulation in the lower legs. 10. Dry mouth. This is another common symptom of diabetes that you should watch out for. A lot of doctors can't really tell why dry mouth occurs with diabetes. However, many believe that it is, again, due to high blood sugar levels, which is associated with the disease. Some dry mouth symptoms to watch out for include continually dry mouth, cracked and dry lips, and trouble speaking, swallowing, or chewing. These can also include mouth infections and sores, as well as dry and rough tongue. Don't miss this early warning sign and talk to your doctor about it along with the rest shared here. 11. Fatigue. It is another sign of diabetes to know that you should watch out for. Fluctuating blood sugar levels is one of the causes of extreme fatigue among people suffering from diabetes. This results in the body not being able to supply enough glucose to every cell for energy. And then there are also different conditions that can lead to fatigue, as well as lifestyle factors, such as poor sleep quality and dehydration. Others are lack of physical activity, obesity, hormonal imbalances, psychological issues, and deficient diet. 12. Unintended weight loss. Unexplained. Unintended weight loss is another early warning sign to watch out for. It can be due to diabetes or other conditions like cancer. It is best to check with your doctor for the right testing and diagnosis. Now, if you're a type 2 diabetic, you'll have excessive glucose in your bloodstream, and it spills into your urine. This can lead to weight loss, even if you're frequently eating to satisfy your hunger. The bad news, people who lose weight unexpectedly may suffer from more complications if they develop diabetes. These complications may include diabetic nephropathy and retinopathy. 13. Irritability. Mood changes are another diabetes type 2 sign, although other conditions can also cause it. This is why you should not conclude that you're a diabetic if your mood changes frequently. The mood changes related to diabetes are often coming with other symptoms. The high blood sugar level and blood sugar fluctuation may be some of the reasons for the shifts in your mood. The highs and lows in your blood sugar level may also be related to mental health symptoms such as anxiety, irritability, and worry. 14. Tingling, pain, or numbness in your hands or feet. Fluctuating blood sugar levels may affect blood circulation. It may also damage the nerves. When this happens, you might feel a tingling sensation or pain in your hands and feet. And these tingling sensation and pain wouldn't happen if you manage your diet properly. What foods should you eat to control blood sugar? We've listed them down in another video which you can click right here.